Good morning, friends. It's an absolute pleasure to be here in Kathmandu. It's been about a year that I've been in WHO, moving from academia, and Kathmandu is one of the first places that I visited as a regional advisor for digital health, and it's always a pleasure to come back here. So thank you for having me here. What I will do is over the next 45 minutes, that's a fairly long time, my first goal is to ensure that I provide you a very high-level overview of AI in health and how do we essentially achieve this goal of making responsible AI in health, but also the other personal goal is not to step on the toes of other speakers. So let me see how I go about it. So what I want to do is I want to inspire young people here. So I will move from fiction to science. I'll first move through some more evidence that we have and why is it exciting for folks like me who have essentially been working on AI for the past decade or so. Now, to briefly tell you my background, I'm a physician by training, but then went to medical school and the School of Data Science in the US. I'm now a faculty both at the Yale and UNC, and essentially where I teach AI and machine learning, and more specifically applying AI and machine learning in healthcare. What I will do is I will talk a little bit about, oops, I think you need, okay. Does it not go back? Perfect, thank you. Thanks. Now, what is extremely interesting is for the first time ever in mankind, we've had one field getting Nobel Prize in two different specialties. On the core fundamentals in AI, we've had a Nobel Prize in physics, and then on applications of AI, we've had a Nobel Prize in chemistry last year. So essentially, AI is truly revolutionizing it. But what is really causing this is not really that the explosion of AI is more specific over the past from 2022 onwards. But why is truly AI exploding, and what are potentially the reasons? Now, there are 6 broad reasons, but I want to first highlight that AI is nothing new to the scientific world. If you can actually see this, it's way back in 1956, we had the first ever conference on AI. But the reason why it is truly exploding, the first reason actually is global data. It is essentially doubling every 2 years. So the huge amount of data is what kind of helps AI grow. And then you actually see that the computational power, the ability for you to compute in terms of the GPUs is actually doubling again every 2 years. What we're also seeing is the reduction in the cost of training your AI systems. Globally, what we're seeing is that the validation accuracy of achieving 93 and 93% above has actually reduced in the last 5 years. And added to that is the exponential growth in AI research. The amount of publication that you see globally is essentially quadrupled in the last 5 years or so. But you also see this massive change from the private sector, where just the 3 big firms, Microsoft, Google, and Meta, have essentially invested close to $152 billion last year. But what we also see in terms of the science is that a variety of fields are now converging. It's not AI alone, but you would also see other emerging technologies like AR, VR, robotics, all of them essentially converging to create this explosion. Now, you can see that there are a variety of other converging exponential factors, all of them contributing to this explosion. Now, over mankind's evolution, it's not that AI is only the first ever truly transformational technology. If you look at it, the first one is steam engine, right? Steam engine truly transformed transportation. But we also see railroads, we've also seen telephone. But then one major technology that has truly transformed our lives in the last decade or so has been internet. Now, when studies now show that the impact of AI alone is going to be 3 times the impact of internet itself. And that itself is one major reason why globally people are very excited about AI. And the very fact that we are sitting here to talk about how is AI going to create this impact on healthcare is one of the reasons why this convergence of technology is creating these waves. And therefore, there's a lot of optimism globally on AI, while I would talk a little more about the risks a little later. Now, let's deep dive into AI in healthcare in general. Now, healthcare in general is an extremely difficult sector, because if you look into the amount of digitization, we contribute just about 5% of the entire global data. Now, added to this is that while there is a growing contribution of research in AI, so you would see a lot more work at the pilot stage in terms of AI in healthcare. But what we would also see is that there is a huge myriad of use cases from bench to population. So essentially a large amount of publications, large amount of research is at the bench, is in the lab. And as the first speaker talked about, how do we really bridge this gap between bench to the clinic and then truly scale at the population? That is essentially the challenge, and I'm sure some of the speakers later would talk about how do you really take AI at the population level. So you would actually see that most of the AI is essentially now focused more on the individual health systems and pharma and medtech. And so you do have a vast number of variety of use cases that emerge. And it's extremely difficult to talk about each one of them. What I will do is I will lay down the road. Now, in terms of the fact that in terms of AI, the one major revolution that has happened from traditional AI is the large language models and the generative AI. From 2017, when Google came with the transformers, which actually contributed to the ChatGPT. So the ChatGPT's T is transformer, and transformer was actually a contribution from Google. And in 22, when ChatGPT came in, after 22, there has been an essential war between the big tech firms and the open AI labs in coming out with a large number of large language models. So you have some closed AI models like ChatGPT itself, but you also have a large number of open AI models like Llama from Facebook. So essentially, what is happening is you would see that from 2017, where the Google Transformer came in, we were all essentially working on the BERT models and Robotas in the past. And then when the moment ChatGPT came in, it kind of led to a huge evolution of a large number of language models. Now, it's almost on a weekly basis. Somebody who's in AI research, someone like me, find it difficult because the exponential number of LLMs that have grown, and I'm only showing you till 2023, but 24 alone, we've had close to 40 different large language models that have come in. So the world is also moving from LLMs to what are called large action models. So now, essentially LLMs, you give a prompt and then you have a response, but now we're moving towards what are called large action models, wherein you give a prompt and they would also conduct the action for you. So now, if this is what is the global reality, what is AI and where is AI really demonstrating its evidence, early evidence? One of its early evidence is essentially in diagnostic radiology. Now, diagnostic radiology, most of them felt with AI coming in, radiologists might not have work to do. But today, the understanding is physicians and healthcare workers who use AI are probably going to replace physicians, healthcare workers who don't use AI. It doesn't mean that AI is going to replace people, but it is healthcare workers using AI. And you can actually see this here, that locally adapted systems are performing better than what are generalizable AI models. Now, not only in diagnostic radiology, we also see the fact that AI is being implemented at large scale, at the population scale in screening for diabetic retinopathy, for instance. And you can actually see that the sensitivity is just around 87 to 90%. Specificity is around 98% for detecting for referral diabetic retinopathy. And therefore, you would see a variety of studies, both in LMIC setup as well as in Global North, where AI is being used for diabetic retinopathy screening. Now, the other major space where we are seeing a large amount of AI work is in pathology, where digital pathology is, again, one major space where you actually see a lot of work around AI, and specifically cervical cancer screening as well as breast cancer screening, both with mammography as well as thermography. So essentially, you would see that both in radiology, digital pathology, and in diabetic retinopathy and certain screening of diseases, AI has essentially moved from the pilot stage to the clinical setup and also to the population level, but with varying levels of evidence. Now, but there are also some very interesting studies that we see now, where this is one very interesting but very controversial study that came in from JAMA. JAMA being very important academic literature. It kind of published this interesting study where it said that physicians who use AI and comparing them with LLMs, it essentially felt that maybe the LLM is coming up with a far more in terms of its quality and in terms of empathy is actually doing better than physicians. So typically what would happen in terms of the study, to give you an emphasis, imagine a patient trying to ask questions to the physician, right? And physicians here, or those who are involved in healthcare, which all of us are, we often have a lot of questions that we want to ask the physician, right? So when we have the LLM responding to the queries of the physicians, people, both patients as well as physicians, felt that the quality of response was better with LLMs. The empathy was better with LLMs than with the human. Now, this kind of worried physicians and other healthcare workers like me, because is this really true? But then there was a follow-up study to this from Lancet, wherein it felt that what AI does really well is this flowery fluff language that it kind of creates. So all of us would feel excited that these large language models, which are trained on huge amounts of data, tend to be more empathetic because it kind of has this very beautiful covering sentence and the nice ending sentence. But what is the crux of the evidence? The physician does not really have the time to give you those empathetic sentences. He would probably be more straight. So when we dug deep into it, a follow-up study that happened, it said, yes, in terms of the quality, not really. Empathy, probably yes. So there is essentially a training part which really helps in the responses of the ChatGPT. Now, what you would therefore see is the kind of early evidence that is coming out is fairly mixed in terms of using AI. Now, the other three broad areas, I know that there are other speakers who dig deep into it, but we're also seeing some very interesting work of using AI for drug discovery, for instance. Both in terms of drug repurposing as well as pharmaceutical development. There's an entire pipeline of using AI for drug discovery. But there is this very interesting work of using AI for infection forecasting in ICUs. One of the earliest study came from Hopkins, which was again very controversial. Now we realize that the study was extremely controversial. But then there is initial work which kind of is eye-popping, but it's probably not so much of evidence. The other study is essentially on how do we use AI for public health response to infectious diseases and LMICs. Again, here we have some initial studies. So what I want to tell you as great audience sitting here is you would see a lot of research evidence. So, but is this really bridging the gap between what you see in bench to what you would actually see in a clinic? Now let's go to what is the other new major change that's happening in AI, which is essentially on multimodality. So a lot of AI models that have been built, when I talked about in radiology and pathology, they were all using unimodal, which is just either imaging data, or some of them use just text data. But now, with the capabilities that our large language models have, and with now moving from what we call as this change from generative AI to agentic AI, we now have this multimodality capacity. So you would potentially have not just images, but you'd also have non-imaging data. You'd also have text data. You'd also have non-text data. You'd have voice data. All of this would essentially result in much more complex models. And this is essentially where you could then use to train your AI models, not only for detection, but also for prognosis. And therefore, you would see that the complexity of what AI can actually do, both in healthcare, is actually growing. And in fact, we have our first ever study where we use this multimodality in radiation oncology at both UNC at Yale in the US, which is an AHRQ approved study. But this is, again, fairly early now. This is just emerging right now. But what we see now globally, and I'm talking specifically about the US healthcare system because that's where I've worked for about a decade or so, is that hospitals, their sense of AI readiness, you would actually see is fairly low. I would just want you to stay with, say, Stanford instance. Stanford is at a staggering 12.7. Now, Stanford probably, and I'm picking on Stanford just because I have a lot of collaborators there, and I hope they'd be comfortable with my referring to Stanford. The very fact that Stanford was the first healthcare system to have a chief AI scientist with the two-line job role. The two-line job role was every AI machine learning application that has been developed in research at Stanford, please bring it to clinical setup. And two, demonstrate that it actually works in clinical setting. With this two-job role, it's taken the chief AI scientist in Stanford, and they were able to just deploy only 2 applications from the lab to the clinic, essentially showing the huge amount of challenges between the amount of potential that AI has to what it sees on the ground. So what I'm trying to highlight here is that even as AI is exploding, its true potential in terms of making that healthcare service delivery, in terms of truly in creating that impact, both in terms of patient safety as well as improving quality of care, is fairly early. So let me summarize all of this in this 2x2 matrix chart. What I have here is on the left-hand side, I have in terms of risk. On the horizontal axis, I have on the value-based care impact. What you would essentially see is that most of what we are seeing in the healthcare system are essentially at the low risk. We are all driving to a place where we have most of our work is around automating clinical notes because you want to reduce the documentation burden for physicians. So you have these ambient AI tools which are being deployed in high resource settings, essentially to reduce the burden. So you have this low risk, but in terms of, and this is essentially where the mainstream is. You would see medical images such as CTs, X-rays. You also have these EMR embedded clinical decision support systems. So this is essentially where most healthcare systems, even in the global north, are working. Now, what you want to go is, you also have the science fiction, which I'm going to talk about a bit, where potentially you would have a fully autonomous robotic surgery. Are we really going to go there? Is there a potential chance of that? I'll, of course, leave you with some food for thought. But today, what we have is essentially around this space, but there is a future potential for digital twins, for personalized treatment plans. There is a lot of imagination, in my opinion, not so much of science. So you do want to, overall, at the end, as a pure clinical AI researcher for someone like me, our goal is how do you balance innovation with safety? So how do you strike that balance where you move towards, your axis would move towards the right, but then you would also want to go into a place where reduce the risk. So that sweet spot is something where we've not been able to strike globally. Now I want you to think from this imaginative world where I moved from huge euphoria to slightly more depressive one. I want to kind of what's really happening in the healthcare sector is also that the private sector is moving fairly fast. You would see that Google research or Microsoft research, whether it is Amazon, all these big tech firms are essentially putting a large amount of dollars in healthcare, right? And then the potential of Gen AI is something that you'd hear globally. But what is it that you would want? I mean, as people going to healthcare systems, you would want to essentially realize that anything that gets into healthcare is properly regulated. And so you have the first one, which is the EU AI Act, which is by far the first ever regulation on AI. And just very recently, just about December 26th, which is the act from South Korea, which is the Basic AI Act, which is going to get enacted only from 26. So you have globally some evidence where countries and governments have essentially started realizing that there's a need to regulate AI and come up with responsible frameworks for AI. And you have this AI governance as a way forward, with the UN Secretary General talking about it, and the highest authority there talking about governing AI for humanity. So globally, there is this conversation on how do you really balance this bridge between risks and benefits of AI. Now, so essentially, today regulating AI is not an option that governments have. But then how are we doing globally? So globally, when we looked into about these 193 countries across about 10 dimensions over 3 pillars, what studies show is that the governmental AI readiness especially in 2023. This is, of course, dated just about a year later study. What we have in our region is there are just about 5 countries in the Southeast Asian region which are in the top 50 in terms of their governmental AI readiness. Now, if you dig a little more deeper into each one of them, what we see is that countries, their governmental readiness is essentially in the top 70s in the first 3 countries. The technology-wise, that's where we are probably in terms of course, the technology parameter is about how do you bridge the gap, what is the ecosystem that is available, and of course, the data infrastructure. That's again where the countries in the Southeast Asian region are certainly have a way to go forward. So what I would want to highlight here is while the potential exists, LMIC countries and countries in Southeast Asian region certainly have more steps to make, both on the technology as well as the data and infrastructure. Now, even globally, what you would see is, if you look into the global index on responsible AI, you would only see countries in North America, Europe, and Australia, which have essentially made the first steps on the regulatory pathways, on regulatory frameworks for AI, and regulatory AI for health in specific. So you have most of the LMIC countries at a responsible AI index of less than 50. So that's where most governmental action and governmental call for action is there. So what is WHO essentially doing to support member states on AI in health? We did have the acting WR talk about it, but WHO has been working with technical agencies like ITU and WIPO to create what is this global initiative on AI for health, which essentially has 3 basic parameters. One is on enabling, second is on facilitating, third is on implementing. So this is a initiative that's been launched in 2023 and 24. We've done a variety of guidance documents, and I'll walk you through that. We've also had the strategic roundtable on AI, where we essentially talked about what are the opportunities, risks, and challenges associated with AI at the World Health Assembly in 2024. Now, this is the variety of guidance documents that have come from WHO over the past year or 2. These are a large number of documents. These are all open source. We will give you, we will also ensure that you have, by tomorrow, you have links to the QR codes to all these publications. These are all open source. These are widely available. Now, for the first one, which is the WHO guidance on large multimodal models, which is essentially the LLMs, what we did was we wanted to kind of talk about it at 3 different stages. What do you need in terms of during the deployments phase, on the development phase, deployment, and the implementation? So the WHO guidance is essentially for large language models, recognizing that this process is a multi-stakeholder process. We also have these regulatory considerations for AI for health, which is again something that was launched in 23. And in this, what we've done is, because of this, now there are about 80 members and about 28 countries who are now using these guidelines to drive their regulatory frameworks. We work closely with all the member countries, but we do have countries that have identified here which have made the first steps. We're also working, therefore, to initiate this multi-stakeholder dialogue between developers and regulators. We have a community of AI for globally that works very closely. We've also realized in this guidance, where we talk about when, what, and who are our major stakeholders, researchers, developers, regulators, manufacturers, healthcare workers. We ensure that it is a multi-stakeholder engagement process as we build these guidelines. I will leave these guidelines for you to go through when you read them. What I want to just stop here is the fact that we realize at WHO that this cannot be a singular journey. It has to involve collaborators, and you would see collaborators both from academia, from industry, from governments, from the nonprofits. So it involves a wide variety of stakeholders, because essentially the speed with which AI is moving is much faster than what all of us, a single organization, can lead. So what you have is, here I will just stop for a minute to just tell you that we also recognize that we need to create an enabling framework. So we work very closely on establishing, benchmarking, and testing for standards. What as we do as WHO is essentially to recognize that when AI machine learning models are built, we would want those models to use local data. We would want to ensure that these models are locally tested. They have to be tuned for the local users. So this is essentially where we have this establishing benchmarks and testing protocols. And I'm sure the next speakers are going to talk a bit about how did they benchmark their models, how did they test on their local population, and ensure that they meet true standards of building AI machine learning models. Now, we also recognize importance for guidance and governance, benchmarking and localization. We also partner for success, so we have huge collaborations. What I will do is here, I'll just tell you on how the collaborations happen. We have a large community of AI. All of you can participate. We'll again share the link to that community. So typically, the community is one which talks about how do you plan, what are the important areas where guidance would be needed. And then typically we look in conducting an evidence-based study. And after that, we have the technical advisory committee, which looks into this evidence that has been generated. And then the first thing that we do is we either come up with a technical brief, or we think about, okay, if we need to co-create, we generate a WHO guidance. So typically this process of coming out with the WHO guidance document takes about an year, because as WHO, whatever we want to share, it has to be science and evidence-based and should also be implementable. So therefore, the process certainly takes time, but all the guidelines that have come about are built on robust science and robust evidence. Now, but I also want to give you some inspiration for thinking around AI, because this essentially is my area of interest, where what is it that AI could do going forward? So this part is again fiction for you. So I kind of started with fiction, went into some bit of science, and now I want to leave you with some food of thought on what AI could do in the future. So I will present some ideas for you on what is happening globally. As I talked about, there is essentially this phase where robotics, simulations, and physical tasks, and there is a lot of growing potential for AI. So what you're seeing now today is a large number of, where are these big tech firms investing today? The big tech firms are essentially saying, we now need to focus more on these humanoid robots. So what you would have, therefore, is all the major big tech firms investing a large amount of dollars on these humanoid robots. And the capabilities that these have is scary to an extent, but they do have a potential to replace a lot of physical manual work that we all do. So you would actually see that they are ambidextrous, they have a certain finesse in their activities. So you are now seeing, they're all at the different stages of the deployment, but the capabilities that these humanoids have in each model is competing with the other. Now this is essentially has something which has huge implications even in healthcare. What I also want to kind of talk about is, as these humanoids come in, it's not that these humanoids are just doing very physical labor. As I talked about, the dexterousness with which they can perform variety of fine tasks is also something which is amazing globally. Now, the other major space where somebody talked about is the autonomous mobility in the world models. Today, you have major firms like Tesla and others investing on these autonomous models, and then there is this worldview model. So essentially, just like how as human beings, where we have a three-dimensional view of the world, a real-world model is now emerging now with the advancements that we have in AI. So what you now have is the autonomous vehicles certainly have an ability to scan three-dimensionally, and also look into every change that's happening in the real world. So essentially building world models that human beings can build. Now, have we really reached the stage of AGI? Probably not, but you can actually see that these have implications even in healthcare going forward. So what I wanted to kind of throw another interesting idea is this large-scale work impact. Traditionally, we started from this belt and line shaft, then moved to this 20th century assembly line. But I think there is a large impact that is going to go, that is to come forward. Now, think about a scenario where if you would go to an Amazon center, you ask for about 20 items. The traditional model was to say you would think about each of this fulfillment center. You would have a person who would need to move to each shaft, right? And you would think that you would collect material from there. But today, what Amazon is essentially saying is, the individual will not move to the assembly shafts. It will be the assembly shafts that will move to the individual. So you're using this large AI models which will actually automate this entire process of fulfillment as well. So think about this in terms of healthcare. Imagine you go to a hospital, you would have to walk through different labs, right? Imagine the lab actually walks to you. So this is the large-scale work that is yet to come, and the potential that these have is truly mind-boggling. Now what does this all result in? Essentially, the war between the big tech firms today is on how do you capture electricity and power. Because what you want to do is that most of these AI machine learning or any of these big tech firms are essentially investing a lot more energy and power. Because power and the way climate change is going to change. And so you would see that the big tech firms are now competing for purchasing power from nuclear power plants. So this major deal that happened between Microsoft and OpenAI in essentially buying a large amount of power is essentially started an entire power race for capturing electricity. And that's, of course, going to be the key constraint going forward. Now, what we also seeing is, this is again dated in my opinion, because your large language models are not just churning out text from text, but they're also churning out text to audio, text to videos now. Now, just looking into it in 2024, when Sora came in from ChatGPT, Amazon came with the next one, then Llama, the Meta came with another big video generation. So essentially, in the next 2 years, it's very likely that you would have a Hollywood movie completely generated from AI. That is the potential with which these AI models are being built. So you have this video generation, and just to give you this last slide for you to think, there are 3 big companies investing millions of dollars just for one thing, which is video generation. And these are just 3 small startup companies. So the potential that AI has, and therefore, I think the world is therefore going to be divided into 2 sorts of people. People who use AI are certainly going to replace people who don't use AI. It's not that AI is going to replace human beings, but people who use AI, and therefore to build capabilities to use AI becomes an extremely important component. I just want to leave you with one thought. I think going forward, what is going to be essential is that studies show that as students and researchers start using LLMs, our cognitive capabilities are going to make a major change. What is going to be very important is that data that you need is going to be widely available, but what is going to be very important is, do we have that critical thinking in us to ask a good question? So asking a good question is therefore probably going to be an important skill, and therefore they said 2024 was essentially an age year for prompt engineering, and probably 25 is essentially going to be an year for agentic AI. So I want to leave you with this thought. Thank you so much for your attention, and thank you so much for the time and the opportunity to present here. Thank you.